Autism Quality of Life Podcast, Episode 10.
And we do a systems change. We are talking about looking at preventative strategies, teaching effective behaviors based on functions, and then looking at those consequences in a positive fashion. We're also really engaging ourselves with caretakers, or what we call stakeholders, those individuals that are in that child or individual's life on a daily or weekly basis, and teaching them the components.
Welcome to another episode of the Autism Quality of Life podcast. With me today, I have Tahra Cessna. And Tahra is a board-certified behavior analyst and has been working with children with special needs for 13 years. Tahra is a co-founder and the behavioral services coordinator for the Treasure Coast Autism Project, a private nonprofit school for children on the autism spectrum. Tahra is also the clinical director for Positive Behavior Supports Corp, an agency that serves individuals with disabilities and severe behavioral challenges. Specifically, Tahra utilizes the principles of positive behavior supports to improve quality of life for individuals with autism and their families. So Tahra, how are you today?
I'm doing well, Teri. Thank you for having me.
Thanks so much for coming on the show. So if you wouldn't mind filling in some gaps from that introduction and sharing a bit more about you with our community.
Well, sure. Thank you. Like you said, I've been working in this field for 13 years, but prior to that, I was a teacher. I worked with typical developing children. My passion has always been the special needs and younger children, but in my career, I've had the privilege of working with children as young as 9 months old on the autism spectrum up to 54 years. And I found I really have a heart for those that are transitioning, individuals that are coming from teenager into adulthood at the moment. So I'm really trying to work and focus efforts there to make sure that their quality of life continues after the school kind of ends. I also do special lifts where I coach paddleboarding, and there's a program here in Florida called Top Soccer, which is just wonderful. It's for individuals ages 4 to 21 with a disability. They're paired with their typical developing peers, and they learn to play soccer. Great program. I have the privilege of working with those children and families as well. So I just feel very honored to be in this field and working with the kids. That just means so much to me. I'm also a mother of 2 boys. They're typically developing, but they help work with myself and my clients, bringing the social skills that may be needed. They volunteer with me, so it's been a great family experience for us.
Wow, well, it definitely sounds like you have tons going on, both professionally and personally. That's really exciting. So I was thinking that today we would talk mainly about the Positive Behavior Supports Corporation. So that's the agency that you're a clinical director for?
Correct. So I'm one of 4 clinical directors. Positive Behavior Support was started 10 years ago here in Martin County, Florida, by our CEO, Dr. Michael Nolan. Back then, there was no mandate to cover individuals with a diagnosis of autism through any funding source other than our state med waiver. So Dr. Nolan and a small team of analysts were helping mainly teenagers and adults, top-tiered individuals, a lot of them possibly in group home settings, not really able to interact in their community in meaningful ways, were brought in to really help them and engage them. So that started very small, and now Positive Behavior Support is in 9 states, and we're working with over 2,500 clients. We started in Florida. We are in Michigan. We are in North Carolina, New Jersey, Hawaii, Texas, Washington, California. I'm possibly forgetting some, and I apologize.
No, that's fine. Just thinking that we might have audience members in some of those states, so it could be helpful for them to know that there are positive behavior supports folks in a community near them. So within the agency, is it specializing in positive behavior supports? Can you tell us a bit more about that?
Sure. So, Positive Behavior Supports Corporation is actually named after Positive Positive Behavior Support, the application. PBS started in the 1980s because what we were finding is we were doing behavior modification. A lot of it was focusing on consequence-based interventions. And while we were being very successful in shaping client behaviors, we found that it wasn't carrying over, generalizing maybe as much. So Positive Behavior Support, the application, takes the principles of ABA, Applied Behavior Analysis, and we do a systems change. We are talking about looking at preventative strategies, teaching effective behaviors based on functions, and then looking at those consequences in a positive fashion. We're also really engaging ourselves with caretakers, or what we call stakeholders, those individuals that are in that child or individual's life on a daily or weekly basis, and teaching them the components rather than just, doing an outside assessment and coming in, writing a plan for what we see fit. We include those stakeholders in the process, and also the individual, if they're capable, in this process, and develop a comprehensive plan that's going to improve a quality of life. Where do they want to be in 5 or 10 years? And how are we, going to help them all as a team to get there? And how do we fade our supports? We don't want to be a staple in their life. We know, it's not practical for me to follow a client around 10, 20 years, prompting them through their day. So we really need to teach those skills and transfer it to the caregivers, the siblings, the parents, the grandparents, whomever, and the individual, and help them to be just the most high capable and functioning individual that they can be.
That sounds great. Yeah, so it sounds like you're really focused on the whole environment and family supports and taking the individual's perspectives into account as you're developing plans.
Absolutely. It's so important that, we think about the individual and what are their goals, because oftentimes as parents, we have goals for our children and where we see them. But I think it's important that we ask them those, certainly the ones that have the cognitive capacity to speak on their own behalf. And I think we need to take that into consideration, even if we find that it's maybe something they're not able to do at this point, or that's really way out of left field for something we ever thought for you. But I think it holds value, and we really need to look at helping them to achieve that goal, no matter how big it may be at the moment.
Yeah, so you mentioned that one of your passions right now is working with individuals who are transitioning into adulthood.
Absolutely.
Yeah, so I'm curious, how might you apply positive behavior supports to someone who is working on developing life skills, for example? Like, what might that look like for an individual?
Well, depending on their age and their capacities, we would do an assessment, some type of a curricular assessment, an evidence-based assessment to identify some deficits and strengths. I would definitely math. Stands for Planning Alternative Tomorrows with Hope. And I would look at where you want to be in a year or 5 years, the ultimate dream. What is your ultimate dream? And then I would work with that individual to set short-term objectives to help us to get there. So let's say their goal is to have a job. I want to work and I want to get paid. Well, I need to find out, what are your interests? Then we need to find out, what are your strengths and what does it take to hold a job? Well, we need to have a good communication skills. We need to be timely and prompt. We need to be able to be clean and have transportation. We need to be able to interview and write a resume. So we set those short-term objectives and find those deficits. Maybe this individual is very social and they have good communication, but they lack personal hygiene, for instance. Maybe they are not able to use public transportation and can't drive yet. All right, so how are we going to get them there? We work on that, teaching those skills in isolation. And we find that if to the goals that we're teaching, they're more apt to want to participate more and learn them quickly. So really just looking at what's appropriate and important to them and building on that. So that path is looking at their dream, finding out what they want, and helping to get there in small capacities.
Nice. Okay. You mentioned quality of life a couple of times in the types of supports that you guys are providing to clients. So in addition to conducting the evidence-based path assessment or other things and developing those goals for your clients, do you have any other measures that you're currently using? So I think you might have mentioned to me outside of this conversation that PBS Corp is developing a quality of life measure. Is that right?
That's correct. We have developed our own quality of life tool. We are now in our second phase. We have revised it. Our most current update, we encompass right now 5 domains. These include health and safety, social relationships, self-advocacy, productive activity, and community participation. And we do baseline assessments across these areas. No matter the child's age or the individual's age, we look at different skills for them. And then every 6 months, we do a post-assessment. Where we find deficits, we build skills, short-term objectives, like I mentioned before, to help get them to a higher quality across all of the domains until they are with a low level of support and a high level of satisfaction, meeting the highest overall score. Once that happens, we realize that we can now fade our services because they're able to transfer into different settings with different individuals, and it's generalizing and maintaining over time. So then we're able to fade out and help others that may need us.
Wow, that's great. Okay. Would you actually be able to rename the doctor who you're working with who developed that measure? I think we got cut off during that time, and I just want to be sure that I have it somewhere in the recording.
Sure. Her name is Dr. Mimi Heineman, and she's a leader in the application of positive behavior supports, and she's a contractor that supports us to make sure that we are on track with our goal and our path as a company, to make sure that we are providing evidence-based treatment using the principles of applied behavior analysis with a focus on families and quality outcomes. So she, along with myself and several other clinicians from our company, have helped to develop this.
Okay, thanks for going over that again. So with Dr. Heineman, is your long-term goal for it to be pretty much used amongst the positive behavior supports folks across your 9 different centers, or are you ultimately wanting this measure to become more universal and to be used in other applications, like in schools or by other people too?
Yeah. So right now, currently, our entire company uses this measure. Every state that we are in uses a quality of life measure. Any family that has ever had us has had a quality of life assessment. What we would like to do is validate this. Right now, it's subjective, right? We're asking caregivers their opinion on the health and safety domain, social relationship domain, self-advocacy domain, for example. We're also interviewing the individual, right? And we're getting a baseline score, and we come in and we do our other measures. But we would like to, with our data, validate this tool to say, are the correlations effective? Do we show that when we have high scores in this quality of life measure, do we actually have high outcomes for quality of life? And so that's something we're collecting a lot of data on. Over, like I said, 2,200 families, 2,500 families using this tool. It's just now gathering the data to show those gains and to say, is this an effective measure? There's companies trying to buy our tool. There's an individual that works in group homes. This gentleman is in the state of California and really wants to focus quality of life improvements for the consumers living in his home. So he wanted to use this measure for them as well. So we're kind of working with him to learn how to adapt this tool for something that he can apply in his setting. But this is something we can use with all individuals, regardless of age, regardless of ability or setting. This is a tool that can hopefully be used and validated across all settings.
Awesome. That's really exciting. Then what is this measure called? Is there a name for the quality of life measure?
It is a quality of life assessment. That's what we call it.
Okay. I think there are enormous applications for this, and I'm excited to learn more about your findings as you start to examine the data from the 2,500 families that have been able to make use of the measure.
Thank you. What's awesome about our company is we also do a quality of work life. So PBS, we actually do surveys for our team and our colleagues to say, to what extent do you feel your work life is giving you quality and meaning? And so we set goals with all the leaders in our company. What are your personal goals and professional goals? We also do this with our analysts in specific regions, and we help them to attain that. So we want to make sure that, they're getting quality of life across their settings too, because we want to practice what we preach.
Well, that's great. So you have another entire use for this measure. So thinking from the employee perspective, and possibilities are endless.
Absolutely.
So what are some of Positive Behavior Support's goals for 2017? So you mentioned that you're working on validating this quality of life measure. What other kinds of initiatives or projects are you currently working on?
So our mission statement, and I'll read that because that really helps to launch our goals, it's twofold. First is to create a responsive system that applies the principles of PBS to meet the needs of individuals and families to produce quality of life changes that last. So this is something that we think about in our day-to-day. How are we going to help all families that need us? Currently, Dr. Nolan would like to be in 10 states, so next year he wants to move into other states. We'd like to add more local offices because right now we're in homes, communities, and schools, but not very many families are able to push into a center base where they can maybe do family trainings and social skills. We really are big on parent trainings. And if we could have a place that parents could come, work together, have that network, that's what we're trying to kind of implement as well. So that's something for our clients. And of course, validating a great accomplishment. Our next mission is to develop an organization that attracts the most competent, enthusiastic people and turns them into proficient professionals. So PBS does a great deal with building a capacity for behavior assistants, turning them into registered behavior technicians, turning them into analysts. We have a whole area of employees focused solely on training, making sure that we are giving our team the best tools for training. We've developed our own registered behavior technician curriculum, our own behavior assistant onboarding. We've got numerous continuing education trainings that we've done, and we offer the continuing education to our analysts for free. If they are an analyst with our company, regardless of if they only have one client or 10 clients, they have access to this library of continuing education. So we really want to make sure that we are helping them to meet their goals and in their missions.
Oh, yeah, it definitely sounds like there's a tremendous focus on staff in your organization. So that's really exciting to hear.
Yeah, we have so many families on a waiting list currently that there's just not enough analysts to go around. There's not enough of us. So we want to grow from within. We want, people to be proficient and energetic and love this field and want to invest in going back to school, getting their board certification, and just supporting this field ongoing.
So for aspiring ABA professionals out there who might be interested in learning more about PBS Corporation and some of your programs, how can they get more involved and potentially apply to work with the company?
Well, it's great. We number one, we pay for them to get their 1,500 hours, which is required. We give them free oversight. Oftentimes, students have to pay for them. We want to invest in them. They don't have to sign a no-compete. They can work for us or anybody else. We don't care. We just want to help our families. So they can apply online at www.teampbs.com. Simply click on Working with Team PBS. You can complete an application, and from there, we do an interview process. We hire people from around the world. We help people get visas. We have several people here on visa because we see value. We want to bring people to us and to support the families in the states that we're serving.
Very good to know. And for families and parents, caregivers who are interested in learning more about your services and potentially getting connected to apply to work with you guys, how can they learn more about the work that you're currently doing?
www.teampbs.com, and the family would click on Getting Started on our homepage. From there, they would complete a one-page referral, give us some information about their child and their funding source, and we would take it from there, verifying benefits and eligibility, contacting them, setting them up with a team to support them in their environments under their schedule. We work in the family's home, community, wherever the individual needs us, under their schedule, whatever works for them. We want to be a good contextual fit for them.
Great. So you mentioned that you work in schools, homes, other aspects of the community. So how does that work exactly in terms of a family who might need help at school, for example? So would they just sign up and enroll with you maybe through waiver funding or do you take private insurance as well? How would some of that work?
We take all funding sources. So certain funding sources allow you to go into the school and others do not. And certain schools allow you into their program and others do not. So it's very case specific. It depends on the program. It depends on the funding source. But if the school allows and the funding source allows, or the parents are paying with a grant or they're paying out of pocket, we go in and we assist the teachers and the support staff. We're not in there to work one-on-one with that child and take away from the school. We want them to learn in that school setting, in that environment. We just set the environment up for success. We teach those individuals the principles of applied behavior analysis, and we make a plan with that teacher, with that support staff. Because again, just as in the home, it has to be a good contextual fit, something that can be carried out with multiple students and one teacher per se for most of them. So we make sure that it's going to work for them.
Okay. So it sounds like it's really a consultative role for you, that you and others are going into the schools and really helping to shape the environment and then working not only with the individual, but the teachers and the entire classroom to really create the best environment for learning and skill development to take place.
Correct. And we try not to only work in a school. So if a family hires us and we're there in a school setting, we also want to work in the home too, because we really want to have the caregiver buy-in. And so it's a wraparound service. We're helping them across settings to make it just, the best improvements that we can for the child in all settings.
Sure. Okay. And what is the average length of working with the client, would you say?
That varies. It's very individual. Depending on the needs of the child, it can be years. But oftentimes it can be, less than a year. It just depends on their response to treatment and intervention and just how well they're doing. It depends on the individual.
Sure. Okay. Yeah, so it can be on more of a short-term basis or potentially go for years depending on the individual. So for folks who might be interested in learning more about positive behavior supports in general, so professionals who might be in the ABA field and aren't as familiar with PBS specifically, do you have any recommendations of certain resources, whether they're ones that you provide or externally, where people can go to learn more about PBS?
Sure. I would look in the Journal of Applied Behavior Analysis or other evidence-based journals for the field. They could look up Positive Behavior Support, Horner and Dunlap, Kogel and Carr. These are all, groundbreakers in this field. I think, looking up any of them and their research on PBS would be great for them.
Great. Okay. So how can our audience connect with Positive Behavior Supports? Are you guys on social media, or do you have certain channels that you tend to communicate with your community through?
We're on Facebook. So all of our different regions have their own Facebook page. And within that, they talk about any community events that they're doing, parent trainings that are happening, just things that are going on within that community. And then, of course, our website at theteampbs.com. What's great about it is caregivers can actually chat with us live. They'll see a picture of myself or another clinician. And if we're on green, that means we're there, and we answer questions 24/7 for them if we're available. But because we're across so many time zones, oftentimes they can get somebody and we'll answer questions to help them. And if they have any questions or their concerns, we can just assist them.
That's awesome. I'm sure that really helped to bridge some of the gaps. And so in terms of community-based, so is a lot of this work, I know that you mentioned the interest in building PBS centers so that families can interact more with each other and develop some of those social communities and potentially have social skills groups and things down the road. How are families and clients able to interact with one another now? Is it primarily through the Facebook community?
Currently, we have 2 offices that have launched parent trainings and social skills. This is in our Miami and our Broward regions. We also have a social skills program, not in a center, but going on in the Treasure Coast of Florida. These are all in Florida. So the families are able to, have their children join that, and they can, when they go to the parent trainings, they connect with one another. But in other areas, we usually host community events for families. And we've had family picnics, we've had family fun days. So we try to invite families, and we have just fun events where we do face painting. Our analysts kind of all step up with their extra talents, and they provide that. So we've had kiddos that have done, for our social skills group, they did a talent show. We had different vendors, local community vendors that participated, face painting and barbecuing, video game trucks, you name it, we had it. And so we do that too to help parents connect with one another.
Nice. Well, it's so great to learn more about Positive Behavior Supports Corporation and the work that you're doing and the mission of the company and how you intend to grow to 10 states in this coming year and develop new programs. And it sounds like you're doing such incredible work. So I'm really glad that we had the opportunity to share some of this with the Autism Quality of Life community today. Do you have any other information that you think would be really valuable to share during this interview?
Just to inquire, if they have any questions, they could go to our website and learn more about the, services that we offer. We are a unique ABA provider where we're big, but we have a very small community feel. Every area of our company is run at local regional centers. So they're making sure that we build those relationships with our families and with our service providers. They're all run individually, so it has that small company feel.
That's great. I love that you really seem to have a focus on the families and staff as well. So just developing really strong training programs and allowing for them to really grow and flourish as employees of the company and to think about their futures. So really exciting stuff. Thank you so much, Tahra, for coming on the show today. I really enjoyed chatting with you and learning more about Positive Behavior Supports Corporation and the work that you're doing.
Well, thank you very much. And, I want to thank Dr. Michael Nolan. He had this vision, and it's because of him that we're growing the way we are and that we're moving in this way. He's really given us the capacity to have autonomy in our roles and guide our teams with, best practice. And, I'm thankful to be a part of this company.
Thanks again.
Thank you, Teri.
Hey, it's Teri Krakovich here. Thanks so much for listening to today's episode. If you're not already subscribed to the podcast, you can find us on iTunes, Google Play, or on YouTube. Head on over to our website at www.autismqualityoflife.com. And there you can also sign up for our e-newsletter and additional content as well as bonus interviews. Thanks so much for listening, Quality of Lifers. Your support really means a lot, and we'll catch you next time.